Your hip replacement. A posterior approach. This video is brought to you by the GPT class of 2014. Total hip replacement precautions. There are three main precautions for a posterior approach hip replacement. Number 1. Hip flexion past 90 degrees. And number 2. Internal rotation past neutral. And finally, adduction past the midline of the body. We will explain each of these in the following segments. For the first precaution, it is important to avoid movements that bring your thigh past the point of your hip, as shown. Again, a closer view. Please do not reach past this point. It is also very important to keep your toes pointed up when lying down and avoid any movements that would point your toes inward. Here's a closer view of the toe-in movement you should avoid. The third and final precaution, please avoid any movements that bring your lower extremity past the midline of your body, as shown here. Failure to comply with any of these precautions by you or your caretaker can result in dislocation of the surgical hip and a repeat surgery. In and out of the wheelchair with a walker. In this portion of the video, we will be discussing how to assume the standing position from a wheelchair using a walker. To begin, the therapist or caretaker engages the wheel locks and moves the footrest out of the way. It is not shown here, but a gait belt has already been fastened on the patient as a safety precaution during the procedure. The therapist or caretaker will be along the operated side of the patient to ensure a safe transition. These safety measures must always be taken first before the transition begins. Once the wheel has been locked and the footrests have been moved out of the way, the caretaker must bring the walker directly in front of the wheelchair. Ensure that the patient is positioned at the front edge of the seat with the unoperated leg placed behind the operated leg. The patient reaches with the hand on the unoperated side to grasp and push down on the crossbar of the walker. The other hand is placed on the armrest of the wheelchair. This ensures that the patient is moving into his or her strength. Force exerted on the walker must be exerted directly downward as shown here to avoid tipping of the walker. The patient pushes to standing and places his or her hands on the side of the walker. The patient is now correctly positioned in the walker to begin ambulation. Getting back in your wheelchair. To sit back down from the standing position, grab the crossbar of the walker with your hand on the operated side, then with the other grab the armrest of the wheelchair. In a slow and controlled manner, lower yourself into a seating position. Again, the caretaker is on the operated side to ensure a safe transition. Readjust the position of your arms and you are now back in your wheelchair. Gait training with a forward wheel walker. The 3-point Step 2 method. There are 3 steps to this walking technique. The order of advancement is as follows: the walker, the operated leg, then the unoperated leg. As the young hip lady walks across the floor, you will notice that she begins the walking sequence by rolling the walker forward. This is the first point. She then initiates her movement with the operated leg on the right, supporting weight as necessary to achieve the desired weight-bearing status. This is the second point. Finally, she advances her unoperated leg on the left up to the point of her other leg to finish the gait pattern with the third point. Again, the order is the walker, the unoperated leg, then the unoperated leg. The gait belt is fastened and the caretaker is standing alongside the patient as a safety precaution during walking. The therapist or caretaker will advance the inside foot to move with the patient. And there you go. Curb advancement with the walker or cane. To advance over a step or curb, first bring your assistive device up to the point of the obstacle. The sequence begins by bringing your device up to the curb first. Then you will advance your unoperated leg, followed by the operated leg while applying pressure on the assistive device. This minimizes any pressure on your operated leg. After the handsome man walks across the step board, he utilizes a similar technique when coming down from the step. First, he places the assistive device down onto the lower level. This time he advances with his operated leg initially, then follows with his unoperated leg. A good way to remember this order is with the mnemonic up with the good and down with the bad, referring to the respective limbs. Gait training with the quad cane. Welcome back. In this portion of the video, we will be demonstrating the correct sequence of walking when using a quad cane. We will first discuss how and where to place the cane. It should be placed alongside the foot with the longer legs going away from the body. The step pattern shown here is the step 2 method shown in the walker portion of the video. To reiterate, the order of advancement is as follows. The patient advances the cane first, approximately 1 stride length ahead. The caretaker or therapist will guard on the side opposite of the cane, stepping forward with outside foot. The patient then advances the lower extremity on the side opposite the cane and brings it up to the point of the cane. Finally, the patient then steps forward with the other leg up to the point of the first step. The sequence is repeated for continued progression. The patient should remain erect during this progression and avoid leaning on the cane. Taking your blood pressure. To take your own blood pressure with the automated blood pressure unit, make sure you are in a seated position with your arm exposed. Take the patient's arm and wrap the pressure cuff snugly above the elbow in the position shown here. Make sure the unit is connected and ready the unit for use. The arrow on the cuff is a general guideline for the alignment of the cuff with your artery. Press the power button on the left to turn on the machine, then the button on the right to begin measurement. Here is a closer look at the procedure. The cuff is placed on the arm as described before. Make sure it is tight around the arm or a false measurement may be given. Again, the arrow does not necessarily have to be along the line of the artery, but can be used as a guideline. 2 numbers will appear after the device is done measuring, with the number on the left indicating the systolic blood pressure and the number on the right indicating the diastolic blood pressure. Normal values for blood pressure are 120/80. Please note any abnormal values and be sure to let your therapist know upon your next follow-up.